Hi, my name is Abby Blanc and I'm a family nurse practitioner at Phelps Health. I became interested in healthcare when I was a senior in high school. I was actually going to become a kindergarten teacher, and my grandparents sat me down with the old Phelps County Regional Medical Center magazine that used to come out in the mail, and it was an article about why you should become a nurse, and they cut it out for me, handed it to me, and said, I think this is what you need to do with your life. After I graduated high school, I started off as a CNA, worked my way up to an LPN at RTC here in Rolla. Then I went for my RN at ECC here in Rolla, and then a few years down the road I decided to go for my bachelor's at Chamberlain University online, and then I went for my master's right after my bachelor's at Chamberlain University as well. 3 fun things about me. Number 1, I am a mom of 3 girls, so I completely understand if you have to bring your child in with you to your visit. It is perfectly okay with me. I understand the wild and craziness of children. It's okay. Number 2, I absolutely love pigs. Anything to do with pigs, including the fact that I do not eat pork. That's how much I love pigs. And number 3, I have been in the healthcare field ever since I was a baby. My mom runs a local nursing home here in Rolla, and I grew up in there. So a couple years ago, when I was working as a cardiac nurse up on the floor here at Phelps Health, I had a patient in his late 30s, early 40s that came in because his glucose was over 900. He knew he was diabetic, but was told that he didn't need to take his diabetic medication anymore. So I was going back through his chart with him, looking at everything, looking at his A1C, and I believe it was 14, which if you don't know is extremely high for a diabetic patient. And I spent at least 2-3 hours with him going over medication, going over diet, going over everything that I needed to do, how to check blood sugars, how to draw up his insulin, give him a shot. And then a few months down the road, I got a message through our chat system from our secretary saying that this man called up asking specifically for me and stating that he wanted to make sure I knew that he got his A1C down, I think to like an 8 or something like that, and really wanted to thank me for everything I did for him that day. I hope that my patients get a well-rounded experience with me when they come to see me. I want them to make sure that when they come in, they don't feel rushed, that they feel heard, and that I'm here for them as a whole person and not just an ailment that they are brought in by.